It's the True Sports Physical Therapy Podcast. Tune in, you might just learn something. Catch all of the full episodes on all streaming platforms, and as always, the link is in the bio.
Talk to me about strength testing. How do you test them? How is it different than your standard shoulder screen, if it is?
So normally when and again, manual muscle testing, like we know, is super arbitrary, super subjective, testing left and right side, getting a sense of just strength, but also like endurance. So like, I'll hold it for a little bit longer. So I'm going to do, a basic, especially for rotator cuff, neutral position, they're seated, ER, IR. And again, you're assessing with pain with all these structures. Usually that's fine. If they're having symptoms, usually you're going to get it at 90-90, but I'll do ER, IR, and neutral by their side. I'll do it in a 90-90 position. I'll do it in a scaption position. I'll also even do it on their stomach and in prone. So I'll get a sense of IR in supine, ER in prone, all things like that. I'm also looking at, I'll have them on their back.
Why do you do it in both? Why do you do it in both?
Both supine and
prone, yeah.
Just to get a sense of, right, when they're in supine, their scap is stable. It's on a hard surface, so it has a sense of stability. So sometimes, if there's a scap deficit or scap weakness or poor, scapulohumeral rhythm or scap control, you might see that more when they're in prone. It's also going to be a harder position for them to recruit rotator cuff. So you might see compensations like, especially if they struggle with ER strength or ER range of motion, you might see rhomboids kick in for scap retraction. You might see upper tract kick in to try to cheat. You might not get that in supine.
Yeah, no, I love that. I think that's totally worthwhile. It's also a good opportunity to see what the scap is doing, like you're saying, like how are they compensating? So you see that in prone. It also gives you an opportunity to help their scapula. I call it a scapular placement test, and we'll get into special tests in a second. Mm-hmm. But if you can decrease their symptoms by doing the job of their rotator cuff and their scapular stabilizers with the therapist's hand, that can go a long way to say, hey, if your scap stabilizers were just doing their job, look, you would be stronger and you would have less pain if indeed it's a positive test, meaning the symptoms go away when you place and hold scap. So I think there's some wisdom there. Are you doing this all manual muscle testing? Do you wish you had a handheld dynamometer? How else would you test it?
I do right now do it all just with my hands, manual muscle testing. Handheld dynamometer would be nice because then you could see obviously rotator cuff strength, things like that. It is hard when comparing numbers, if you're going to go right side versus left or dominant arm versus non-dominant arm, because that non-dominant arm is going to be weaker, sure, especially if this is your first time seeing that athlete. So you don't really know what their baseline was. You just know that it's either weaker or it's about the same, things like that. Naturally, you're going to know that dominant arm is going to be stronger than the other dominant arm, especially with rotator cuff and scap muscles in general.
So sometimes that's true. My pushback on that is we know that along a season, depending upon where you are in the season, the more you throw, the weaker your cuff gets.
Yes,
yeah, which is counterintuitive. So a lot of times I'll see guys towards the end of the season and their dominant arm external rotation force output is actually lower. than their non-dominant. So I think it's still worth testing. You can also use a Tyndek for this. We've gotten pretty creative with how you set that up, whether it be in supine or whether you be in a half kneel position.
Half kneeling.
Yeah, to mimic those, and then also look at rate of force development because they might have the strength, but how quickly are they kicking it on? So I think there's what to dive into there. I would encourage everyone listening, if you don't have a Tyndek, get a Tyndek now, just so you can compare. It's a great visual feedback to create buy-in and then train around. As you're rehabbing these things, it costs you $100. It's probably a good investment. Okay, so if that's your manual muscle testing, you talked about ranges of motion. Are you using a Goni at any point? Are you actually measuring them like they taught you at LBC?
I will use a Goni if I'm like, oh yeah, that's a big deficit. What are we at? Mm-hmm. If not, I will eyeball it, and my LBC professors will not love me for that. Yeah. Just because I've seen a ton of shoulders, and this isn't to like toot my own horn. You can get a sense of where they're at and where they need to go, especially in the thrower and things like that. Naturally, as long as you know that total arc is super, super close, then you're going to be good. But if you see an extreme deficit, like if you're lacking a ton of external rotation, let's measure it. Let's look at your IR. Oh, you're 30 degrees off. This could be a reason why your shoulder's bothering you, because you don't have the range of motion or the structural support to even throw right now. You're stuck at 90 or 95. And as a pitcher, that's not good.
Sure. And I think also it's an opportunity to give you an exact number and then create buy-in or show them a difference, right?
Right. That patient knows, oh, I only have 90 degrees of external rotation range of motion. I'm 30, 35 degrees short of total range. I need this right now. Right.
Yeah.
Work on, mobility, but then make sure you're also strengthening in those ranges because they've never been there.
Yeah.
Or they haven't been there in a while.
Okay. So that makes a lot of sense. So now I'm assuming I'm going to hear about special testing. What do you do? How much, I guess, emphasis do you put on your special tests?
In a super aggravated shoulder, if you get one in the thrower, I mean, 9 times out of 10, everything you're going to do is going to be painful. So you have to take that with a grain of salt. I'm looking at rotator cuff special testing. I'm looking at labrum special testing. Those are the big ones that you're going to see. Sometimes you're going to see some bicep tendonitis, so testing for that. So
do you care though? Do you care? Hey, I got a positive speeds and a negative empty cam. So I say to the athlete, this is clearly long head of the bicep tendonitis. But is it going to change what you do?
No, it's not going to change at all. I think the biggest thing that if you're going to do that special testing is obviously see what structures are involved. You're going to get a good taste of that, but you're already going to be able to tell based on a basic assessment. But if it's something major, like, oh yeah, we definitely have a massive labral tear or stuff like that, or if they're having massive multi-directional instability in their shoulder and things like that, maybe they've tried PT in the past and have done it, and it just hasn't, hasn't been picked up. But from a rehab standpoint, none of those tests are going to change, in essence, what I'm going to do or what we're going to do. It's all going to be close to the same, really.
Yeah. Okay. That's what I thought. And then you're going to send them home with a home exercise program, right? How do you determine what you give them? How many do you give them? Walk me through your prescription of that.
So obviously what I'm going to give them is going to be dependent upon what I'm going to see. Usually it's an issue, especially in your younger athletes, but even in your, higher level guys, it's an issue with, rotator cuff strength, usually like that end range stability type things, as well as scap control. Obviously too, like what we're going to give them is going to be based on what they have access to and what they have need. Baseball players are usually always going to have bands and J bands. So usually that's something that I know they're going to have. And I discuss that with them. What do you have at home? Do you have access to your gym? No, you do. Great. So bands are going to be great, especially for your younger athletes. So right away, I like to give them some form of rotator cuff isometric just to get that shoulder in a good position, whether they're having pain or whatnot. It's just going to be a good primer. So usually I'm giving like a uppercut hold, or I'll add like an uppercut hold with a turn. So then they're getting scap on the turn. From another strength standpoint, I'll also give, and you'll pick this up when you're looking at, let's say, like their scapulohumeral rhythm, and this is along the lines of bands, like a banded T. But what I'll add with that is make sure a lot of times you're going to see cueing, you're going to see upper trap activation, cue kind of center, but I'm also going to add in that retracted position, kind of like these lower half snow angels. So they're able to kind of work down, help bring their scap back and in, or from that abduct in an upperly rotated position to a more neutral position where we need. So when they're raising up or getting into layback, they're not already swung out.
And how much pain, I guess, let me ask you this. Where are you telling the athlete they should feel these things? And how do you respond if they're feeling some of it in their with their symptomology?
So your rotator cuff exercises, anything like we're doing with that, you should just feel it along the path of that muscle building the tendon. So good cue for me is like, do you feel that in the backside of your shoulder? A lot of the times what you'll get, especially if someone's having, like, let's say posterior shoulder pain or anterior shoulder pain, when they're doing a rotator cuff exercise, they may start feeling like, I feel the front of my shoulder, I feel pain there.
Yeah.
And that's usually because that shoulder is sitting in an anterior related position to the glenoid and it's rounded. So a lot of times, like if you're just doing basic like dumbbell ER or sideline ER or banded ER tubing in neutral, that shoulder is just kind of like internally rotated and positioned, anteriorly. So they're just kind of stressing those anterior structures, that bicep tendon. They might even feel like their biceps doing work. So getting them to cue into a more neutral position. And a lot of that's just like we talked about, like that's how that scap is sitting.
Yeah.
So
and
gently getting those shoulders back. Now let's feel it. And then 9 times out of 10, you're like, okay, I feel the backside of my shoulder. I feel it there now.
Yeah. And now you're all the way into private practice ownership and management. And if if your Instagram tells somewhat of a truthful story, you spend a lot of your time with professional athletes. How did you get to that?
I think the biggest thing was, okay, so I have a CSCS, but the CSCS is nothing more than just like scratching the surface in terms of where it creates a baseline, but then now it's like, how creative can I get with this baseline? Right. And I think at that time, Instagram was just starting to blow up. I didn't really use Instagram as a way to market myself per se, but I had a couple athletes that I was working with through some internships that I had while I was at University of Miami working with some of their athletes there. And, it's a D1 school that is a huge producer of NFL athletes. And, there's a lot of agents that kind of hover around there. And just like I said, through my own networking experiences and that sort of thing, rubbing elbows with these guys, it turned into like, hey, why don't you train this guy a little bit? Maybe do some linear speed training with this guy. I helped one other guy get ready for his combine prep. So it was just like here and there kind of dabbling into it. And then it's word of mouth from there. And then once that turned into word of mouth, is like, I always tell my PTs, one patient equals 3, because if you're doing a good enough job, then they're going to talk to their friends about it. And they're going to, send their people over to you. So that's kind of how it spiraled.
That sounds like a great spiral. Aside from one patient turns into 3, I think that's great psychology, business advice to start with. What advice would you give to someone who wants to be where you are? Like, give me the one pearl that to the sports therapist that's listening to this pod that says, man, I want to run something like Crew Lab. I want to treat that demographic or population. What's your one piece of advice to them?
My one piece is a great question, but I have a lot. But I would say demonstrate value. You have to demonstrate your value. People think that value is inherent once you get your DPT, or once you get your CSCS, or once you get your your SCS, whatever it is. They think that the value is there, and the unfortunate reality is that's what gets your foot in the door. Right. So it's just like an MD or a DO. Like if you're going to be the world's best surgeon, you don't just step out of your surgical residency just because you earned it and you put the time in there and you have an MD. Doesn't mean you're the best surgeon now, right? Yeah. You still have to demonstrate value. So I think that is overlooked tremendously. And I think that we're in the age of fraud right now, where people could film for 3 days straight and make it look like they have a lot of value. And then when I walk into a meeting with them and we start a discussion, I quickly realized that there is no value there. They just had a branding team that helped position them in a way that made them look like they had value.
Yeah, I think that is awesome advice. And I think it's so important to take that advice and also apply it to the person in front of you. What is the value that you think they need or want, as opposed to the value you think?
Yeah, so it's actually twofold. So you're saying the up and coming clinician, what kind of value do they need? You have to have, it's not your arsenal, if that makes sense. So I don't care that you took a kettlebell class. I don't care that you took some type of Bosu ball balance proprioception class. I don't care that you did the FMS screen. I want to know how you integrate it and make it something different. Yeah. Because athletes learn extremely fast. So something that I teach an athlete within 20 minutes, it probably took me 3 months to get that down. And then I teach it to them in 20 minutes and I'm like, shit, how do I make this harder? Yeah. How do I progress this? How do I progress this? How do I make this more hard? Okay, what other element can I add in here that's going to create that challenge? Yeah. And it's about protecting the athlete, number one, but also providing that stimulus and that challenge. And you have to exist within that window. So it's not necessarily what certifications you have, but it's more so how you apply it and how you add your own level of creativity to it and keep it within that bell curve of not challenging versus too challenging and putting them at risk.
Yeah, and I think it's a small nuance, or I'll piggyback just a little bit, which is sometimes it's so much easier to progress and make harder that exercise, and you have like a hulking linebacker, you want to make it very difficult. I think it's another level. It took you 3 months to learn how to do that. It probably took you 6 months to learn how to make it easier. Like, how do you scale these things, right? Yeah. To still challenge it, because that's when I know clinically, that's where I run into some issues is, crap, this athlete, this is way too hard. It's way too hard for them. How do I make it easier, still achieve the goal, and make it safer, right? And allow them to do it and still challenge.
I love the fact that you brought that up, because I was just teaching this to a student of mine that we had come through. But, this person's coming in 2 weeks off of a ACL repair. And we had bone, patella tendon bone, and we want to challenge this athlete in a way that they find value in coming to us, right? Yeah. Versus going to a hospital-based system. We're a self-pay hybrid model. But you could take that athlete and make them throw up in their first visit.
Yep.
And they still have their stitches on, their dressings on from the original surgery. Mm-hmm. And you just made them sweat so hard and throw up and vomit just because you provided a stimulus that had nothing to do with the knee. Mm-hmm. Right. And that's and not that you have to do that, but I'm not encouraging people to make their athletes throw up within their first visit. But what I'm saying is
that would be a good title for the pod. Right. How to make your athlete puke.
Very, I got to put that disclaimer out there for sure. But no, it's really important that, like you said, when you scale it back, okay, that's great, but how do I make this still feel like a workout for the athlete, that they're engaged?
Yeah.
Right. Yep. Because keeping them engaged is half the battle.
Yeah. Yeah. Absolutely. I think that's great advice. It's great business advice. It's great sales advice. I think you're on the money with that. I want to get a little clinical. So with the fact that Crew Lab deals with so many professional athletes, these athletes, and by the way, high-level professionals, whoever it is, have very tight schedules. They have demanding training regimens. How do you ensure compliance for this athlete? How do you make sure whatever it is you're prescribing, they're going to have time to do it? And then overlay that maybe with, they have an overuse injury, so they're already kind of in the red. How do you get them to, one, buy in, and two, be compliant and not piss their tissues off?
Well, the buy-in, I think, comes from laying out the whole program in front of them, right? So that's really important, that they see that you have an idea of, you have a framework, you have a skeleton that you're going to be working off of. Like it's just like any other ACL protocol. But, within that, I'll say, okay, we're also going to be doing uppers on this day. We're going to be doing lowers on this day, whether it's upper push, lower pull. We're going to be doing more cardiac output, stuff on these days. These are the different, this is our menu block to pick from in terms of, what we could do to challenge your cardiovascular system without, pissing off whatever your injury is and all that kind of stuff. So showing that you have a plan is number one, right? To create that level of buy-in. Mm-hmm. But specifically the athlete that is already a pro, not the ones that are going pro, but the ones that are already pro. I mean, these guys have different events to get to. They got OTAs. They have, OTAs we already planned for, but it's mainly the travel schedule that they have to deal with, and flying all around. And it just seems like there's just never enough time to get it all in. And the hardest part with that is that it's like, a lot of times I just have to have constant check-in with these people, of okay, what did you do between Monday and Thursday? Like, who did you see? What did you have done? I have certain athletes that they see 5 different clinicians. Right? You know, this guy is the guy that I let crack my neck. This is the guy that I let crack my back. This is the guy that I go to for dry needling. This is the guy who I go for neuromuscular therapy. And it's like, dude, I can do all those things. But it's if they want to tap their head and rub their stomach and it makes them feel better and feel like they could run a 4.3, then guess what we're doing that day, right? So it's like, I'm not going to convince them otherwise. There's a certain level of patient education that you have to do, but I'm not going to sit here and be like, oh, okay, well, you have to get your neck cracked with me, and you got to do your dry needling with me, and you got to do your strength and conditioning with me. Otherwise, I won't see you. It's like, you got to play within the boundaries that they want to work in with as well. You know, these are grown men. So when it comes to a younger athlete, I just wish that they had more guidance as a younger athlete of like, you know, being able to put your trust into one person. But I would also say that, you know, South Florida guys are a lot different in the sense of, you know, they were exploited as young athletes very, very quickly.
Yep.
And you could take an athlete, you know, these guys are people down here, like half these athletes that I've worked with, you know, were adults, their own parents were betting on their games, you know, at 12 years old. So it's like you're being exploited very quickly, and it's like it's very hard to trust to establish that level of trust. Try to find me some kid in Pennsylvania, in my hometown, that somebody bet on his game when he was 12 years old. You're not going to find it. So they're much more, you know, inclined to trust you easier, which makes my job a little bit easier. But in terms of taking an athlete and building that trust and working around their framework, I think you have to show that level of flexibility and that you're willing to be flexible with them. And sometimes it's not perfect, you know, and you got to be okay with that as a clinician. You got to be okay with the fact that it's like, okay, I've been working on this kid's knee. We're trying to get this lesion to go, you know, to subside and the swelling to go down, and we're trying to build the quad back up. But he's only coming in, you know, sporadically. He's here 3 days in a row, and then he's gone for a week. Then he comes back for 1 day, and then he's gone for 2 weeks. It's like the best that I could do is give them a protocol to work with, and then make sure that I have a line of communication of whoever they are seeing so that they understand what I did last.
Yeah, that last piece really hits home for me. The idea that it's rarely perfect. You're rarely rehabbing in a perfectly sterile situation where you get all it is that you want. It is the concept I just read about called wabi-sabi. Wabi-sabi is the idea in Japanese architecture that there will be imperfections, and we almost need to celebrate those imperfections and understand that that's the real world versus this like cookie cutter CSCS DPT world where it's like, here's the algorithm and the protocol you follow. These guys got to get on a plane. They got to run out and sprint. You got to celebrate some of that and include that. I think that goes a long way. Tell me how you apply periodization when you're so seemingly random, although I know there is a thought process behind it. What does periodization look like over the season?
Yeah, that's a really good question. I had someone ask me that actually after my talk, and the reality of it is I wouldn't say I follow a specific periodization model, because the reality of
Molly,
it is,
that's crazy.
I know. The reality of working in collegiate team sports is that there are 8 million variables that you are fighting against on any given day. And so for me, I literally take it day by day. And when I don't mean I just make up workouts as I go day by day, but honestly, as I've gone, the more I do that, because things are always fluctuating. But what doesn't change is I know in a given time frame, whatever part of the year it is, whether it's early off season, late off season, preseason, in season, I know what qualities I'm trying to target. Like those things never go away, but like how you get there has to be really flexible. I used to write out 4-week programs, and then I'd, have multiple blocks of 4 weeks that lay out my entire year. And then I was like, why the hell am I doing this? Because I've never even written a 4-week program that has stayed the same. It's like it's constantly like moving things around and figuring out puzzle pieces. And so I've really just gotten like, if you're clear on your principles, clear on what you want to achieve, what that looks like on a day-to-day basis can change.
Yeah.
And that is where you have that flexibility to like, there's a lot of room for input from the athlete. Like I know ideally like what total volume I want to be around, whether, depending on what quality I'm trying to target, but like how we get there changes. And like the means that we use to get their change all the time. So I think that is something that's changed a lot for me. And like when you can relinquish that control a little bit as a coach, because like as coaches, we inherently crave control. Everything goes a lot smoother, and you realize that like what you choose to do doesn't matter as much as just making sure that you're moving in the direction that you want to go to.
Yeah, those are interesting points. That lands for me in the sports rehab setting. We use electronic medical records, right? And so part of it is, do you want to opt into the flow chart option? And since we've been in existence since 2014, we don't use the flow chart because every time that athlete walks in, we're doing something completely different. So it doesn't help me to pull forward, right, from our last workout. It's based upon what they tell me that day, depending upon what our goals are, and we will play with the variables in there. So it sounds very similar.
Yes. Yeah. And it might be like, I'd say I like to work with ranges a lot. So whether it's rep ranges or it's kind of load ranges, I can't tell you the last time I actually prescribe somebody a load. It's more so it should feel like this. I try to keep it as simple as possible for our players. Maybe we use a 1 to 10 scale. Like it should feel like this. And what that is on a given day changes. Like what might feel like a 6 one day, maybe they're lifting 135 pounds or something. The next day, a 6 could feel like lifting 50 pounds, whatever. Like it constantly changes. So I think just based on like, again, you have your target, you have the range that's still going to keep you in that target. Okay, let's figure out how we work with that. I like to give options. Like, okay, this is option A. If you feel great, this is what you got today. Option B is this modification. Option C is maybe you just need a recovery day. Like, oh, you haven't been sleeping. Like you just broke up with your boyfriend or girlfriend, whatever's going on, like giving them room to adjust, like still doing something that moves the needle in some way. So I think, again, it just kind of comes back to like, I think adaptability is the most important quality in a successful strength coach, like in the team sports setting, because nothing goes as planned. You could spend so much time writing out the perfect training program, and I guarantee you after maybe the first week, like it's completely different than what you thought it was going to be.
Yeah, I think that's really well said. Okay, so a freshman walks onto South Carolina campus. They're meeting Molly Binetti for the first time. What does that assessment look like for you?
Yeah, honestly, the first thing we do is like I just have them in my office and we just have a conversation. I think the most important piece is knowing our athletes. And for me, like I spend more time with them than anybody else on our staff because I get the most time with them, and I'm at everything. And our coaches know that if they're not where they need to be physically, like they're not going to do well out on the court. So what that looks like is I'm just asking them a lot of questions. From a training standpoint, I'm asking them about their experiences in the past, things that they like, things that they don't like, or things that they feel like help them or don't help them. Asking them like, what is it that you really want to accomplish here? And like getting really clear on where they want to go and the things that they want to do. And then like building that partnership with them of like, okay, like I'm here to get you to that point. Like, this is what this is going to look like. We're going to figure it out together. But I just want to talk with them. I want to get as much information as I can. And then from an assessment standpoint, I'm going to take them through kind of a battery of just some really basic movement patterns. Like I just want to, it's nothing formal. Like there's no formal assessment other than I'm going to take you, I want you to do a squat. Show me if you can do a lunge or a split squat. Can you do a push-up? Can you do a drop off a box and just land? Or can you land on one leg or like drop into a single leg landing position on one leg, not off a box or anything. And then I'm going to take them through a battery of jump tests and just both subjectively and objectively look at their jumps. So obviously I'm tracking metrics on those, but I also just want to watch them and how they load, how they take off. Do I notice anything, right to left, and just kind of make note of the things that I see, just watching them move in kind of these various positions and then jump and land in these different tests. And
what are you measuring aside from quality?
Yeah, so we do a counter movement jump with hands on hips on our force plates. I always say the handful of metrics that I really care about, I look at their eccentric rate of force development. I look at their jump height based on their impulse, and I look at their concentric impulse. look at their RSI mod. So basically how high they jump and how fast they jump. So basically how efficient is their stretch shortening cycle. And then I will look at their peak power per body weight. So what's their relative power and how does that change as their body weight changes as well too. I would say that's one that we do most often. We jump them a few times a week on the force plates throughout the year. And then I do a battery of tests on our jump mat just to look at a couple different things that are a little bit more simple. Like the force plates are awesome, but you can get so far into the weeds. So when we got them, I wanted to keep it as simple as possible so I could learn it the best, but also keep it really simple for our athletes too to learn.
Yeah.
And then on the jump mat, we do a repeat test. So I want to look at how quickly they can get off the ground, their ground contact times, both on 2 legs and on 1 leg. And then we do a strict just jump off 1 leg as high as you can and then come down and land on 2. And I look at the difference in that right to left side. So I look at loading strategy. And then obviously I look at, from a metrics standpoint, I'm just looking at jump height and what % difference is there. We know there's going to be some, but like, is it huge or is it within what we would consider normal?
Okay. And why use the jump mat for those instead of just keeping all of that on force plates?
From a simplicity standpoint, like you can get a million metrics. And like when we first got those force plates in, I just wanted to learn one jump and like really learn the ins and out of the kind of movement jump. I could do it on there, but from a time standpoint, the jump mat is super quick and it just gives me really simple information. And that was also something that I'd been doing prior to getting the force plates. We just got force plates like 2 years ago. So I wanted to keep that in there from a consistency standpoint rather than go everything to the force plates, which I may do at some point. But
And I've heard you say that the term warm-up is a misconception. So tell us, how would you categorize you preparing your athlete for a workout?
Well, like warm up, like it kind of alludes to like warming up the body, right? I think that's like way oversimplistic and it just misses a lot of very important categories. So, it's not like our body's our car, right? Like we need to warm up our car. Like,
Right.
It's far more complicated than that. So it's like movement prep and just prep and tissue prep is, a much more accurate and specific term. But I mean, you can throw out warm up, but as long as like in your head, that it's far more detailed than just warming up the body. So it really goes into tissue and joint specific work and patterning. So, get the athlete focused. That's number one. Focused on the task at hand. Get them mentally attuned to what they're going to have to do. Kind of give them a little bit of a rundown of what you plan to do that day. Elicit some feedback from them, see how they're feeling. Make sure they're ready for the training in case you have to do any change of planning. I mean, all of that should be done at the beginning of the session. And like, don't you have the athlete get in there and start jogging or something? That's crazy. And then it's just like, very joint specific. I love isometrics, joint specific holds. Put a joint under tension to get the tissue and the tendons ready to go. Like I'm a big fan of isometrics early in the workout. So, like 2 things go into force, right? And one of those is acceleration or speed. And that is the one that has the biggest impact on how much stress a tissue or joint experiences. So why don't we just take all of the speed out to begin with, find the joint angle that hurts, have them hold that for a while, see if it still hurts. If not, if it starts to go away, then we can increase the joint angle and then start to add some speed and load from there. So just tissue prep. And then after that, it's just whatever sequence or movement you're going to do to that day, find something that kind of mimics that pattern so that they can get their body moving in the sequence and the pattern that they're going to have to do at a slower speed.
Well, dude, I love the attention to detail here when you're talking about warm-up. I think far too often, athlete walks into a facility and it's like, okay, let's do some band walks and then get rolling. Or even worse, let's just raise your body temperature with something not so specific. And that's your general warm-up that it sounds like can be far better. So I love the attention to detail you have in prepping your athlete. You've come up with a beautiful sequence that you call the slow, the flow, the go, the grow, the show. Now, it's a little wordy for me, Judd, but can you just walk us through what those terms mean to you?
Yeah, sure. So backing up just very briefly, like the jog, like a lot of people go into a gym and jog as a warm up. That is an impact. People forget that jogging is impact. The last thing, especially as a trainer, if you're a trainer, this is, unless it's a very young, healthy kid, and even then, I don't know, if you're a trainer and you start with an impact form of warm up, that's almost unforgivable. So like just no impact at the very least. All right. And then going into what we're going to talk about, like, things don't have to be complicated. You can be detail oriented, but this stuff can be very simple. It doesn't have to be very complicated or hard to understand. Right. So kind of my deal is like I try to find the essence of things, right? And try to maximize economy of time and efficiency. And so there's a lot of different ways to skin that cat. And so we just have to kind of find a way where we can dumb it down and make sense. And these things don't have to fit perfectly in these, slow flow, grow or go grow categories. But, there's things that like tend to have characteristics about them that may make them more suited to one or the other, if that makes sense. So it's not like an exercise is firmly in this category and it's firmly not. It's not that detailed, But basically, the slow is what we just talked about, right? And then it's just very no movement or very slow movement, finding the pattern, finding the joint angle, getting the tissues ready, talking to them, getting their breathing up, things like that. That's kind of the slow. All of this should take not very long, 5 to 10 minutes maybe. Gotcha. And then the flow is like you pick up speed, and that's when you start focusing on those joint. I call them flows, man. It's really just sequencing, right? Because limbs move in a sequence. Right. And it's just getting the body to move in the appropriate sequence on the planes of motion that it's going to have to experience, and then building speed slowly from there. That's kind of the flow. And then, after that, we go into the go. So the go is just athletic type movements that are, if possible, ground based in nature that involve joint sequencing and core involvement, but have an emphasis on the body part or muscle group that you're working that day. So it's basically the athletic move. And there is some like growth stimulus there too, like a single arm push-up or something I would put in the go category, or like a kettlebell upright row or high pull, I put in the go category, hang cleans, medicine ball throws, all go category. And then within that go category, like I flow them through that as well. Like it starts out faster and lighter, and it'll progress heavier, more towards the grow category as we go along, if that makes sense.
Yeah,
but
that makes a lot of sense.
Yeah, I mean, they have power and strength and hypertrophy elements to them. It's not completely isolated. It's just focused more on athletic performance type of movements, things like that. That's kind of the go.
I mean, I think that makes a lot of sense. Sorry to cut you off there. I love the way you look at it really holistically or systemically, right? Like long gone, at least from this, are the days of let's prepare an athlete to bench by moving one joint at a time. You're incorporating the entire body. And I love that with a lot of your movements, because I think as sports PTs, we get so isolated on here's the pathology, here's the joint that is at an issue, here's what I'm going to attack. Whereas as I'm learning this strategy that you're kind of putting forward, we got to prepare the entire system, nervous system included, to make sure that we get the maximal effect, I guess, of whatever our intervention is going to be. So, and I also totally understand the gradient you're talking about, where there's a lot of gray area where things don't just live in one category, but you're accomplishing multiple things with a given movement. So I love that. So then walk me through the grow and the show.
Yeah. So as trainers, like we don't train muscles to be stronger and more powerful. That is not the be all end all of what we do, right? We train our athletes to move like athletes and then prep their tissues within that system, right? So somebody can look at it. Well, this isn't the optimal exercise for chest or pectoral strength or size. Okay. Yes, it's not. Okay. Gotcha. That time will come in that workout. Don't worry. But it teaches the body, and it gives the trainer, me, an opportunity to see the athlete move and make sure that their body, their core, their hips are working to support that pec muscle to elicit the athletic effect on the field that we want. So just because it's optimal for the muscle group does not mean it's always optimal for that athlete. I don't need the athlete to have the strongest pecs possible. I need them to be able to use their pecs in the best way possible. And that requires more than just the pectoral muscle.
Yeah.
And then moving on, and then, we flow, through that go spectrum. That too takes 10, 15 minutes to work out, right? Then we get into the grow. Now by grow, I maybe mean muscle size, but mainly I mean strength. These are the heavy, more conventional strength building exercises. Like, as far as like the athlete can do it anyway. So like if they can do a back squat, if they can do, a conventional deadlift or a conventional bench press, it's that kind of thing in that strength spectrum. So the traditional, 1 to 6 rep range, probably. north of 80% of the 1 rep max. It's like, I'm not inventing the wheel here,
Yep.
you know? But here's the thing with strength, man, and this people don't get. It's about like minimal effective dose and not taking time doing extra that has diminishing returns. So why would I spend 2 hours working on pec strength, chest strength, pressing strength, when 80% of that benefit after the warm-up comes in the first 10 minutes? So the flow, the flow, and the go all get that pec muscle ready to go for the grow. So at that point in time, I don't need to spend a lot of time warming this athlete up for, like, let's say a bench press.
Yep.
I can do one maybe moderate working set to make sure the pattern's right. And then I can just do 2 good solid working sets of bench press in the 85% 1 rep max range. And that is the stimulus I need for chest strength. I don't need an hour for chest strength.
Yep.
Right.
And I think that's really unique. And then as they get into the show, that looks like what?
Show is just like more hypertrophy. So a little bit of strength, but it now just shifts more towards hypertrophy. This is just like for the general athlete. So some athletes, honestly, the show is like joint specific stuff. Like, if it's a sprinter, the show would actually be like a Nordic hamstring curl, which is not really show. It's still go, but we're kind of giving it away from the compound lifts, giving the central nervous system a break, and really focus on like really targeting load on that hamstring muscle, glute a little bit, but hamstring muscle. So the show doesn't really fit there, but for the general population, it's like, all right, man, you worked your athletic abilities, you got your muscle strength, and now it's time you can do a little bit of bodybuilding at the end. Once again, in optimal doses, Yeah.
And so your optimal doses there when you're attacking hypertrophy is?
Well, I mean, you can spend a little bit more time in that hypertrophy range because we kind of need it more than strength and power. Honestly, the volume needs to be a little bit higher and the frequency, right? And it also doesn't tear down your central nervous system as bad. So, you can spend as like 15, 20 minutes in this if you want, because a lot of it too is going to be like single joint movements and stuff. And you can superset those. So,
Okay, so that's awesome. Dude, I wish more of this was seeping out into the sports PT ether. It's so different than your textbook approach. And I also love that you're applying sound athletic and performance principles to the general population, and treating them like athletes. And I think that is a huge pitfall for sports PTs, where we get either so joint specific or so demographic specific, but we're not teaching these cats how to move efficiently and appropriately. And I think this form really speaks to all of them.
So that was my whole intent, is to dumb this down to the bare essentials that's understandable for people, right? It doesn't have to be perfectly correct, right, in order to work. So, a lot of this stuff, people do it in different ways too. I'm not saying my way is the only way to do it, but it's like this like French contrast and things like that just normal people just don't understand that. And they also don't have the facilities and the wherewithal to be able to do that on their own. So it's just not accessible to normal people. So just take all this complex, kind of obtuse, and kind of, a lot of it, like, it helps maybe a little bit, but for the general population, it's not the be all end all. And just taking what really matters and like giving it to people so they can see benefit.
Yeah. I mean, I love that. And I mean, you make the point that the athlete or the client might not have access to these things, or they may not understand those things. I would argue the same thing to the clinician. I think a lot of PTs are missing a lot of these nuts and bolts to look at the athlete so systemically and to get them moving appropriately and really great bang for your buck. So one of the big issues that we have, and you can kind of speak on this from many different angles. One is you're a giant. 2 is you recently had a quad issue. I don't think that's a HIPAA violation because you were pretty public about it. So one of the big issues we have is coming out of a knee surgery is packing on size onto this limb. Whether they're non-weight bearing for a while or they're in a brace for a while, the quad just shrinks up to a toothpick. What is your best advice as to how to lay on or increase hypertrophy in the injured athlete?
So sometimes we have to forget what we know and go back to basics and go back to what works, right? So as sports professionals, we fall in love with ground-based compound exercises.
Sure.
And we demonize certain exercises that have been viewed as more bodybuilding exercises. Well, bodybuilders are experts in one field, and that is hypertrophy. So maybe swallow our pride a little bit, not think we're so much better than bodybuilders, and understand what they've learned over time that has resulted in hypertrophy, right? And a lot of that is joint specific stuff at lighter loads for higher reps, focusing on movement quality and large ranges of motion. So however you want to skin that cat. So, like there is stuff like, blood flow occlusion training and stuff that's really, it works, you don't need heavy loads. You don't need compound movements. The muscle doesn't know how much weight you're using. It only knows tension, right? So how do we use that to manipulate tension to do things that will cause the muscle to grow? And, a lot of times it's these like really like complex movements where there's a time when you need to focus on athletic patterns and movements. And there's a time when you need to simplify stuff so the athlete can just focus on getting the pump in that muscle, And so I don't hate leg extensions. I don't hate leg presses. I don't like sissy squats are great. Like, like line leg curls if done right, seating leg curls, like the bodybuilding stuff actually works really well for muscle growth.
Yeah. Yeah. And I think what we fall into, and I'm certainly guilty of this, an athlete comes in, they're paying us whatever, they're giving us this amount of time. I want to do things that are new, that they don't know. I want to prove my value. And I think that can be dangerous if you're not spending enough time under tension. Right? Like you said, the muscle only knows the stress you're putting it under. So what I'll do is I'll program these things for my patient on off days. Hey, make sure that you're on a knee extension because there's no skill there. I'm not going to coach you to a better knee extension.
That's awesome, man. Yeah. That's spot on.
And so just make sure you're doing it on your own, or I'm going to watch you do it in clinic. And then, okay, you're not going to screw it up. Go do it on your own, or you're going to do it here with blood flow. You're going to do it here with stim. Something that you're proving your value, but once they got it, let them own it on their own and just load that muscle independently. Now,
so a lot of these athletes, man, they only have 2 times a week scheduled with their physical therapist, right? And somebody's on a lot of weeks, they're only really seeing them once, let's be honest. And like everybody knows, to optimize muscle hypertrophy, you need more frequency than 1 hour twice a week, honestly, especially when you can't go really heavy and you got to rely on time under tension. Yeah, that's exactly right. It has to be something simple they can do on their own. Like, at first, it's like every day, when you have an atrophy quad and you can't, I always say, like, if you can't do intensity, like do volume and frequency. And so like, if they have an injured quad that's atrophy from like ACL surgery or something, and I can't go heavy, they need to be doing like sled back pedals like every day, So yeah, that's exactly right, man.
Let's talk a little bit from 10,000 feet. What's the number one mistake you see runners make?
Overtraining.
Okay, they just go ham.
Yeah.
Okay, and so how do you address that? You get someone who's trying to cram in their marathon training, right, to a shorter period of time. How do you coach them out of that?
Yeah, it's hard to convince people that less is more, but really getting that rest is so important for the body, and it's usually folks that I have who aren't actually having rest days in their training cycle. Those rest days are just so important for that muscle recovery and tissue recovery. And so, I try to convince them to back off a little bit. I try to let them know that they're still going to do well. I've heard plenty of stories about folks who have gotten injured and they weren't allowed to run for a couple of weeks because of an arm injury or something, and they end up doing better in their race because they were forced to take time off. Gotcha.
Okay, so that makes a lot of sense. What type of metric do you use for readiness to train? Do you encourage them to get a Whoop band? Any biometrics you look at? Do you ask them to check their resting heart rate?
So I don't do that as much. I am very conscious of people's overall stress levels and overall loads, meaning that it's not, I've had runners who come in and they're like, Mary, I followed my training plan to a T. I had my rest days and I still got injured. What the heck? And I'm like, well, you moved, you went through a breakup, your job was really stressful, you didn't sleep for 4 nights, and all these other factors in life that pile onto our patients, and they don't even realize that, oh yeah, that's taking something out of my body too, and being able to recognize that. So I really like RPE, rate of perceived exertion. I like having them when they write down their race. So now Garmin actually has the function in where it asks you, oh, how did that run feel?
Awesome.
What was your RPE at? Are you happy? Are you like dying? And it actually takes you through that. And so if you are wearing a wearable, you have that information. Plenty of my runners track in a journal, and so I'll have them write how they felt on their run, making sure that if they had a hard run, if it was hot outside, if they were completely wiped out, that they're rating that run, even if the mileage was less, to rate it higher, so that they know that they need to rest a little.
Yeah, I had this conversation with a football player earlier today where he said, "Man, I really got to get in better shape." I'm like, "Dude, you're in phenomenal shape." He said, "Training shape is so much different than competition shape." And so we were running sprints and we were doing it for time and we were doing change of direction for time and things like that. And so we don't realize how much more aggressive and how much more of a load and a tax that takes. I think that does support the wearables world, as long as you can know how to manipulate, your inputs based on that. So I think there's huge value in there. Is Garmin your preferred? It's just what you use.
It's what I'm used to. It's what I use. I do think it's just a little bit more accessible to runners. I think it's priced a little bit better than some of the competition.
Mm-hmm.
And they've really marketed and really made their brand around running. And so a lot of the functions of the watch are really good for runners.
Geared towards that. Okay, cool. Talk to me about recovery. If the number one mistake that runners make is overtraining, how do you prescribe recovery days?
So I definitely want true rest days, right? So I we'll probably get into cross training at some point. I love people doing strength as well on top of it, but you need to have true rest days. So keeping it so that if you have a shorter run day, maybe that's when you're doing other activities as well, so that your day off from running isn't like, oh, I'm off from running, so I'm gonna do my spin class and I'm gonna go for swim and I'm gonna lift some weights because I'm not running today. It's my rest day. That's not a rest day.
Okay, so you're an advocate for taking a full day off. Yeah. Talk to me about that cross training world. Mm-hmm. Since you brought that up, what do you think is most important for a runner to hit? How often are they in the weight room, and what are imperative moves they need to be doing in the weight room?
And so their timing of resistance training is going to be very different if it's early in their training cycle versus late towards their race, right? So we can increase our strength and we can increase our endurance or speed or whatever our goal is for running, but we can't at some point one of them has to level off so that you can continue progressing on the other one. And so if you are progressing strength too late into a running training cycle, you're going to lose your capability of completing the race to the best of your ability. Early on, I want somebody at the gym doing resistance, like heavier load training and building strength in that first section block of their training schedule. So you're probably looking at like the first 4 weeks probably. And certainly if you have an off season, you can push yourself a little bit more. Not all runners have an off season. But I usually have them in the gym at that point 2 to 3 times a week. And then as their load gets higher with higher mileage, I have them back that off and they're doing 1 to 2 times a week. And once they're at that phase, they're doing a lot lighter weight.
Okay. And what moves are they completing?
Oh yeah. So I'm having them do your foundational lifts, right? I want squats. I want deadlifts. Deadlifts are really good at improving speed. So heavier deadlifting can lead to improvement in speed. That's been shown. Lunges, all your foundational stuff, and then core.
Okay, so everything I just heard sounds sagittal plane focused. Mm-hmm. When do we get our athletes moving in the frontal plane, and how important is that?
Sure, and certainly with our runners, they're losing their form in frontal and transverse plane, right? It's the glute med that's our culprit. So incorporating that one-legged work, so one-legged deadlifts, one-legged squats, doing one-legged windmills where you're standing with one foot against the wall and rotating the upper body, doing anything to work in that frontal and transverse plane. That's how I'm challenging them mostly with that. Maybe, some side bridge, side plank, things like that too are nice.
Mary marches.
Yes.
Mary marches. We'll link to a video on Mary marches, which is the number one
I think, influence you've had on my treatment strategy is the Mary March. But okay, so that makes a lot of sense. So you're hitting them heavy in frontal plane. You're also using these compound movements like the squat, like the deadlift, focusing also on unilateral. So all that makes a lot of sense. One thing that I think is sorely lacking, correct me if I'm wrong, is training plyometrics. I think our bounce goes to hell. I think the culprits would be frontal plane weakness because they just live sagittal plane. So that'd be number one. Number two is their ability to produce bounce. So when do you put plyometric training in their program?
Sure. I mean, once they demonstrate the strength that they have the ability to do it, because I have plenty of runners who come to me and their Achilles are on fire. A lot of my older runners, I should preface that, will come in and they'll have an Achilles that's just lit. They can't jump.
Right.
They've never jumped in their life, probably, or not to the degree that I want them to. And so I've really got to prep them for that, make sure that they have the strength, and then starting low and working up. Do you keep plyometrics in competition season? You can, yeah, but it's again, you're like what I call PT exercises in your plyometrics. I'm doing once a week. I don't need them doing it more than that. Okay, and then when they're later in training. And if you put your strength and conditioning hat on, are you including plyometrics in that programming throughout their season? Sure. Okay, yeah. So you're not scared of that, even though they're getting so many repetitions of bounce when they train. Right, because I'm not going to have them do so many repetitions as part of their program. Right? Okay. The program is going to, their plyometrics in the gym are going to be much shorter. Okay. Okay, that makes a lot of sense. Having them do a ton of touches. And that bleeds into what you said previously, which is as load ramps up running wise, you want to peel back on some of that load, strength and conditioning wise or load wise. Okay, so that makes a lot of sense. If the number one mistake that runners make is overtraining, what is the number one mistake that PTs make when treating the runner? So, and this is near and dear to my heart because, as you know, I co-founded a company to try to help physical therapists learn how to treat runners. And hold on, what's the name of that company? How do we find out about it? Finish Line Seminars. Okay. That's finishlineseminars.com. We have our next course coming up May 4th and 5th. Sign up for that. Everyone listening to this should sign up for that at the same time they purchase our ACL course. But okay, so yes, what is your pet peeve? So yeah, my pet peeve is that I've had so many runners come to me through the years and I might be the fourth or fifth practitioner that they've come to. And thank God they haven't lost faith in the field of physical therapy yet by that point. But they come to me, I'm the first one to watch them run. Now, if you had a CrossFitter come in and said that they got hurt squatting, you would never not watch them squat. Yeah. If a runner is getting hurt running, you need to watch them run. And if you're not comfortable watching them run, take a course, learn how to watch them run, or refer them to somebody in the community who knows how to do that. Yeah, and not just watch them run, record them running, yes, right? So you can analyze it appropriately. I think that's really good advice. I would also implore everyone listening to think about becoming an expert in the patient that's in front of you. And more oftentimes than not, those athletes are more of an expert than the therapist is. And that's not a problem as long as you're willing to learn from the patient in front of you. So grill the athlete on how often are they training? At least know the right questions to ask. How often are you in the gym? When is the race? What program are you following? Etc. Because oftentimes these athletes are so type A, they're going to have all these answers. Your job as the clinician is to simply put all of those puzzle pieces together so that it makes sense. Don't pretend you're more of an expert than your athlete. Learn from them. I think that creates a teamwork environment where you're working with your athlete as opposed to you're dictating to your athlete. I think that goes a long way. Did I miss anything on that? No, that's perfect. Oh, well, I learned from the best. All right, guys, thanks so much for listening. Let us know what you loved. Let us know what you hated. We always want to get better. Bye-bye.